Okay, so we're ready to start. Hi, I'm Jen with NuCell Regenerative Health, and we're talking about non-opioid pain treatment options. NuCell has a lot of options for people for managing pain. We see patients who come in, their desire is that their current pain medications work better, or they want to reduce their current pain medications. And in many cases, they don't even want to be on any of the pain medications. And largely what we're talking about is narcotics, that people find them less effective, or the side effects of them are no longer tolerable or supportive of a full life. So we have a lot of options that we like to talk to people about. We recommend you come in for a consult. I'm just going to say that right up front. We do phone consults, we do video consults, and we do in-person consults. Consults, very important. First thing I want to talk about as far as the pain treatment option is a PRP injection. PRP injections have been around for a long time. They involve removing the platelets from the patient's blood. So this is why it's considered regenerative medicine. Platelets are, your blood is drawn, it's spun, and what's called the liquid gold part, which is your PRP, your platelets, are removed, concentrated, and then injected into your body. It's an intramuscular tissue injection. The concentration of this it brings not just growth factors and about 300 other components to the tissue, but it is a way for the body to heal itself. And PRP is effective for many, many conditions all over the body. At NuCell, we do a lot of different treatments with PRP, and you'll see more on that in our other videos. I use PRP, all of us there use it to our advantage as far as health, longevity, and just a full healthful expression. So that's a great option as far as pain management. You would be looking at 1, at most 3 injections. Once the patient has an injection, over the next couple days, couple weeks, about 6-8 weeks, even up to 3 months, you will see constant improvement. So it's not uncommon that patients will come back and have another injection depending on what type of pain they want to alleviate. Some of these injections are covered by insurance as well. Another reason why you want to have a consult. If we can get you covered by insurance, we would like to do that. A big topic for today is the Neurostimulator Device. NuCell is an early adopter of a Class 2 medical device called the Neurostimulator. It is a temporary device. This is not the permanent device that your friends have in their back for back pain. This is a temporary device. It is installed behind the ear, worn 10 to 12 days, and it interacts with the vagus nerve. We do have it's a 20-minute install appointment, so it's very COVID friendly. We do have patients who leave and they have immediate pain relief. We don't guarantee it, and that's why you're supposed to wear it 10 to 12 days. Even if you start having immediate pain relief, please wear it the full 10 to 12 days to get the maximum benefit from this device. Patients see 3 to 6 months of pain management, and insurance is covering 2 to 4 devices a year. So this is a big deal. It is new. It's very effective. You can walk, because it's attached to interacts with the vagus nerve, you are talking about full body chronic pain relief. So what's important to remember is that Medicare covers this. If you have Medicare Part B, Medicare is covering this. Also workers' comp and many of the major insurance companies in Pennsylvania cover this treatment, and NuCell does this treatment. So you come in twice. Come in one time, 20-minute appointment, have it installed, come back 10 to 12 days later, have it removed. And it's very supportive of what's called dialing down on the opioids, so you can bring down your other medications. But I do want to say it's very comparable with other treatments. So none of the treatments that I'm talking about replace a different treatment, but they can add in. So it really puts the control back in the patient's hands of how they want to treat their pain. So I think and that's also very important for pain management. A lot of the chronic pain conditions that we see patients coming in for treatment, cervical, lumbar, thoracic pain, arthritis, TMJ or any other craniofacial pain, depression, anxiety, compulsive disorders, PTSD, sleep problems. These are very positive side effects for the treatment. So, and this is not a factor of the pain being alleviated. This is a factor of the device interacting with the vagus nerve. So we like people to be open to all the things that could possibly change as a result of this device treating their chronic pain. Someone might come in with sciatica, which is a pain, which is one of the conditions that we treat, and they will notice their migraines also go away. Okay, so this is a new way of thinking about pain management, and it is quite successful. Joint pain, neuropathic pain, fibromyalgia, very hard to treat. It responds to this type of treatment. Shingles, vascular insufficiency. So if you go to our website, newcellregion.com, you'll see a lot of the conditions on there that we do help people with as far as those pain treatments. I can't emphasize enough how important this treatment option is now within our state. The third method of pain treatment that we really see a lot of success with is Pennsylvania's medical cannabis program. We are a certifier and a recertifier for the state of Pennsylvania. Pennsylvania has over 8 million residents, and estimates are approximately 70% of these residents already qualify for the state program. You should be buying your marijuana in a dispensary. It's grown specifically, it's measurable, it's treated as medication, and the delivery methods vary. So you can get exactly what you want. Once you figure out what works, you can duplicate it over and over again. We certify people every week or recertify people every week. I would like to just make a shout out to support our dispensaries. The system doesn't work in Pennsylvania if we're not supporting our dispensaries and purchasing the product there. One of the most underutilized methods of cannabis medicine that I see is topical. And this is very important for patients who want to have the pain alleviation on site without any psychoactive effect. As long as the application is not transdermal, there's no psychoactive effect for THC. And we're talking migraines can be eliminated within 10 minutes just from a topical application of a THC cream or lotion. It's also pretty affordable. It's about $35 for a bottle in a Pennsylvania dispensary, and it lasts quite a long time. So, and this is another treatment option that is compatible with all our other treatment options as far as alleviating pain. So our top three that we want patients to consider is, again, the PRP injection. Second is neurostimulation, covered by your insurance, and some of the PRP can be covered by insurance as well. And medical cannabis. There are obviously other pain treatment options that we see patients utilize that we know are effective. Now that most of the public is being educated as far as less pharmaceutical approach to pain management, we can layer in all the other things that we know, all the other treatments that we know work. Micronutrient deficiency, I do want to touch on. That is also something that we do at NewCell. We measure the micronutrient levels in the blood, and we can identify deficiencies. And these are a big factor in depression and anxiety, which go hand in hand with pain. And by using an IV drip, we can see what's missing, replace it directly into the IV, and bypassing the entire digestive system. And within an hour, a patient feels entirely different. This is all part of the spiral up that we want to see happen for all our patients. So you don't have to change absolutely everything in order for the major part of your life to change. It's incremental changes and you begin the spiral up. Things that we see are successful that we don't offer, but we encourage patients to do. Mindfulness meditation. I like to recommend people look at Jon Kabat-Zinn. He currently has a masterclass right now, or you can also study this very specific type of meditation. I think at Jefferson and Penn, and then there's some centers up in Massachusetts. His form of meditation was specifically, he created it specifically to work with cancer patients and chronic pain. It has a lot of medical backing to it, and it is specific for pain. So your brain will not recognize pain signals, and it does work. Another thing that works is hypnotherapy. Again, you're training the brain to not hear, so to speak, pain signals. You can also use these to direct blood flow to areas that need healed. And obviously touch, massage, anything that is going to pump up your oxytocin and your other hormones, all your happy hormones in your brain, also makes pain more tolerable when you have chronic pain. At NuCell, we do hormone replacement therapy, and that's more for our sexual rejuvenation vision, but testosterone, estrogen, all of these things, they're also very supportive of the spiral up in pain management. So I want to thank everybody. I wanted to keep this brief so we could hit all the main points. I emphasize again, have a consult, okay? Please have a consult. We all deserve this information. We all need to know what is available for us and that there are medically supervised new pain treatment options that are not a prescription. So I thank everybody and have a great day.